It is a huge honor today to be podcast interviewing Noel Ananthan. And you're a Canadian. You're up there. Where are you at? In Ontario, Canada?
That's right.
Streetsville.
Well, that's just outside Toronto, Howard. And as I was telling Ryan, it's snowing here today, so I'm really envious of you down in the warmth of the desert.
It's so funny in Phoenix because 10% of the homes are owned by Canadians, and there's more Canadian flags flying in Phoenix, Arizona, than American flags. I think they like to do it so they all know where each other's at to go have fun with and everything. And you guys have a baseball stadium with a roof over it, and we have one with the roof over it, but your roof is because it's too cold, and ours is because it's too hot.
Well, you do have a hockey team down there, Howard, so you have the right balance. Hockey, baseball, basketball.
It is great. So we're the same age, even though you look 10 years younger, and I had 4 kids, you had 5. Are you glad you went for that fifth one?
Absolutely. It was my wife wanting the little daughter at the end, and that's exactly what we had.
So you had 4 boys and then a daughter at the end?
No, actually, we have twins, boy and a girl, and then 2 sons, and then the daughter at the end. And I actually have a grandson now as well, Howard.
And how old's your grandson?
8 months.
8 months. They're just I have my little 3. I have one granddaughter, one grandchild, one daughter, granddaughter, Taylor Marie, and I tell everybody she's my gift for not killing my 4 boys. That's nature's way of saying.
There's a lot of truth to it.
That's nature's way of saying, aren't you glad you didn't shoot them when you should have? All right. So I called you. You didn't call me because I wanted to talk to someone who's into this 6-month smiles and tell us your journey. How did you get out of dental school and end up as an instructor for 6-month smiles?
Well, it's actually a great story, Howard. So I attended dental school at the University of Toronto, and we had a very strong undergrad ortho program. My instructor was fantastic. He was of the mind, get your hands in there, learn ortho by actually treating patients. So I had a great deal of comfort, familiarity coming out of dental school. I did treat comprehensive cases coming out of school, but as with most of us who have hygiene-based restorative practices in very short order, comprehensive ortho lost any degree of efficiency within the flow of the workday itself. So within about 3-4 years, ortho was just out of my schedule altogether. That went on for quite a while. I came across 6-month smiles. I looked into it and saw it made sense. It was absolutely intuitive. The ortho principles were sound and solid. I started into it, haven't looked back since. One of the key strong elements of the 6-month smiles system as well as the community is the support that we provide. So I became very active providing support for other 6-month smiles providers, became involved as a mentor, was asked to become a clinical instructor. So now I teach the both level 1, the introductory course, and the level 2 advanced courses for 6-month smiles.
And how often are you out teaching?
I'm usually traveling about a dozen times a year. So about once a month, I'm out of the office. And then we do have 6-month smiles providers who come into my office who shadow me for days to watch how I work in the practice itself.
Now, who started 6-month smiles?
It was Ryan Swain.
Ryan Swain. You know what,
Rochester.
Ryan? We got it. I got his cell phone number. I got to get him. I should podcast interview Ryan. A creative genius, my God, that guy.
Absolutely.
That guy, he probably has a higher IQ than me and you combined times 2.
Exactly. No, I really am grateful to Ryan, both in terms of his vision, in terms of putting 6-month smiles together as a concept that general practitioners could use, but also his passion and the nature in which he brought everything together as well, because he's very inclusive in terms of having involved many people in a very strategic way. And that's been a large part of why the 6-month smiles system and the community has grown as profoundly as it has.
Well, we'll spend a minute and explain that story. What do you mean how Ryan started? Tell him the Ryan Swain story, how he started that.
Well, he started doing short-term ortho, and he developed a lot of the systems, the techniques, and the procedures, but he also involved a lot of talented and knowledgeable people in terms of early instructors, involving people within ortho to really develop the process. And then that's grown into what the 6-month smiles provider community is now. It's a very mutually supportive group that endeavors to not only support providers, but allow all of us to learn on an ongoing basis. Because, really, as well as I do, great dentistry is a constant learning environment. It's something where we can look and be stimulated walking into the office each day saying, I'm going to learn something new with each and every patient.
So what do you say? Let me let me throw. This is Dentistry Uncensored. I like to talk about them. And I don't want to talk about anything everyone agrees on, but I want to talk about the 4,000-pound elephant in the room. And the 4,000-pound elephant in the room is that orthodontists are flipping patients every 15 minutes. And they're doing ortho for this fee schedule for about 50% overhead. Then the general dentist starts doing ortho, and they're doing it in half-hour sequences, and they're charging less money than the orthodontist. So how does the math add up?
Well, two things actually with that, Howard. The first part is the fact that the timeline in terms of the treatment sequence or the treatment protocol for 6-month SMILES patients is, just as the name implies, about 6 months' time. So there is a time efficiency in terms of absolute chair time itself. The other key element to 6-month SMILES as a system is the degree of delegation that it does allow. So it involves a huge number of team members in terms of being able to get hands-on with the patients, and it allows us as dentists to be free to continue to be productive in the restorative operatory as well. There's an interesting anecdote that one of my fellow clinical instructors tells me. He tells me that a bad 6-month SMILES day is when he actually has to put gloves on and get in the mouth of a patient.
So it's kind of, that's amazing. I noticed you have braces on right now.
That's right. I have the 6-month SMILE braces on. Good eye.
So tell me on short term, what's in it for the patient, the dentist, the practice? Why are you a big believer in this? Yeah, go ahead.
Great questions, Howard. So one of the key tenets of 6-month SMILES is allowing our patients to have options, not feeling stuck in terms of wanting or cosmetic options for their teeth themselves. Very often, I was in this situation where I referred a good number of adult patients for comprehensive ortho before I started 6-month SMILES. They'd come back and tell me, no, I'm not going to go ahead with it. I don't want braces, especially metal braces, on my teeth for 2 years. From a patient standpoint, they're given another option, the ability to have braces on their teeth in a cohesive timeline that allows alignment of their teeth, provide them cosmetic improvement, and in a very efficient way, in an environment in which they're comfortable as well, in their general dentist practice, one that's tailored to them. In terms of the practice itself, I can't begin to expound on the benefits to the practice. So there certainly is the productivity in terms of bringing in the productivity of 6-month SMILES treatment as a billing procedure itself. But it's also well beyond that in terms of the ability to involve the team, the excitement that it brings about, both with patients and team alike. It really does empower all of us as dental professionals. And that goes straight from the front desk staff, treatment coordinators, managers, right onto the clinical staff to feel great about what we do.
The old saying, if your only tool is a hammer, everything looks like a nail. And sometimes
Exactly.
I'm sitting in these cosmetic dentistry cases and cosmetic courses, and I've been thinking to myself for all of 28 years that so many of these cosmetic veneer cases, and if they just would have unraveled the teeth for just 3 months, I mean not even 6 months, they could have saved so much tooth reduction. And so many of these I just don't think you can say in 2016 I am a cosmetic dentist if you don't work very closely with an orthodontist, or at least yourself know how to unravel these teeth.
Exactly. Could I tell you a couple quick stories just relating to that very specifically? First of all, one of my patients, Jackie, she came to me years ago as a patient of record and said, I want a better smile. Now, we'd already decided that veneers were part of the treatment plan, but I gave her a referral to an orthodontist. At that time, I wasn't doing 6-month SMILES, and I told her what I wanted to do was see her teeth lined up a little bit better. It would allow us to be more conservative and give a better result. Now, Jackie actually went through 3 separate consultations with great orthodontists to whom I refer routinely, great bedside manners, great technical skills. Each time she came back and said, I'm not going to have braces on my teeth for 2 years. We had her in the chair for the actual prep session. Before I leaned her back to anesthetize her, I looked her in the eye and said, Jackie, there's nothing that would make me happier than for you to tell me right now, let's abort this appointment. I'll have the orthodontics done. I'll line things up the way you want me to, and we'll get it done right. She chuckled and she said, I told you, there's no way I'm doing it, so let's go ahead with this. Now, that was about 8 years ago, Howard, and she's still a patient of record. Each time she comes in, she's beaming from ear to ear. She loves those veneers. Every time that I look at her smile, I cringe a little bit because I see the differing gingival heights. I see thicknesses of porcelain, and it really irks me because, again, in this day and age, we're looking for minimally invasive dentistry, something that's going to be healthy for the patient and has the ability to be beneficial for them, not only aesthetically, but periodontally as well. Now, the other story I'll tell you is actually my very first 6-month smile case, Nathan. He actually came to me. He was in his early 20s. He had just started a job as a car salesman, no insurance benefits, and his father had told him, I'll pay to get your teeth fixed up in order to start your adult life properly. Nathan came in, his teeth were a mess. He had caries in every single tooth, including labial caries on his anteriors, upper and lower. So we took him through the hygiene sanative phase. I scheduled 6 1.5-hour restorative appointments to restore him by sextant. When we finished that last appointment, he looked in the mirror, and I thought he'd have at least a smile on his face. Didn't smile at all. He just simply asked me, can we put veneers on my teeth now? That took me aback a little bit because I hadn't ever bothered to ask him, Nathan, what is it that I can do for you? Well, we treatment planned the veneers. It was about $12,000. His father approved it, gave us the credit card number, did the record, started the diagnostic workup. I took the 6-month smile course, came back from it. I had my receptionist call Nathan that Monday, bring him in, and I told him, we can do the veneers, but I'm not going to. I'm going to treat you the way that I'd want a family member treated. He was a little hesitant, but went through 6-month smiles. It transformed him completely, Howard. He went from a shy, meek, demure person. I really thought he'd have trouble even approaching potential clients, let alone selling a car, to someone who was very confident in himself. He's actually gone back to school now because he's transformed the way he looks at himself, and that's simply because he has a smile of which he can be truly proud. So really a game changer all around. And certainly as it relates to our ability to deliver cosmetics in a conservative manner, just amazing, Howard.
So a lot of, most 95% of all the emails I get from at howard@dentaltown.com from my show, they're all, a couple years out of school. I mean,
Yes.
I'd say 5 years out and younger, and a good portion of them are dental students. So explain to them, what would be the difference between 6-month smiles started by Ryan Swain? What year was that started about?
Let's see, it was probably about 8 years ago or so,
It was
eight,
only
nine
8
years.
years ago?
Yeah, not that long actually.
No
So
kidding. Okay, so there's 6-month smiles started by Ryan Swain. There's Invisalign. There's PowerProc 6-month braces by Rick DePaul. Is it all just 3 different brands of soda, or what are the difference?
okay, well, great question. So again, for one of the things I want to applaud you with is the support that you provide, not only dentists in general, but especially those new grads, Howard. They're looking for guidance, and you are a tremendous resource for them. What I do want to say is that the 6-month smile system as a brand itself really sets itself apart in 2 ways. One is our constant endeavor to improve on the breed. There is currently a lot of work going on behind the scenes to move us the next step forward into the digital age with fixed braces, cosmetic braces. The second, and one that is a little difficult to really comprehend until you get involved with 6-month smiles, is the level of support. 6-month smiles uses an online forum to allow the provider community to gain access to actual active support for their cases. They post photos. Clinical instructors like myself and designated mentors are on there constantly in order to provide support for providers, not only assessing their cases, but treating them through as well. So whether it's determining, is this patient appropriate for 6-month smile treatment, right on through to, I'm at this stage in treatment, how do I go forward from here? We're on there providing that support. And so not only has the system itself been designed to be efficient in a GP practice, but the nature of the confidence boost and the ability to deliver on great results for the patients is enhanced by the support that we provide for the 6-month smile community.
And that's at www.sixmonthsmiles.com, that community?
Well, the forum itself is a closed forum, right? Or so
But
it won't.
would you find the how to register for that forum at sixmonthsmiles.com?
Well, you register for the forum once you become a certified 6-month smile provider. So you'll gain the information regarding the 6-month smile system at www.sixmonthsmiles.com.
But
And then once you,
it's six spelled out, SIX
yeah,
monthsmiles.com.
actually, I think even if you place the number
Oh,
6, you'll
really?
still log on.
Really?
That's right.
I'm going to check it out. www.sixmonthsmiles.
And there are 2 pages there. One is a patient page and a dentist page. So if you click
You
on the
are
dentist
correct. You can get
in the
there
upper right
spelling it
side,
out or the number.
exactly. One of the great things with the patient page is the fact that last year we did some testing as far as direct-to-consumer campaigns and got a lot of great feedback from it. So we're going to be looking at that in the future as well. But there's a Find a Dentist section that you'll see on the upper left-hand side that allows patients, prospective patients, to actually find a dentist, a 6-month smile provider in their immediate area. So again, it's a great resource, and that's the nature of 6-month smiles in and of itself as a corporation, always looking to enhance not only our ability to deliver great results, but being supportive from the standpoint of incorporating it as an efficient aspect of a profitable practice.
So how much is the course and how long is the course?
Okay, the course is a 2-day course. It's about $2,800 US. We carry out the course in a variety of different locations across the US. So a lot of wonderful opportunities to see different cities, do a little bit of traveling as well. It's 2 days. It's relatively intensive. We start at 8:30 in the morning, carry on through 4:30 in the afternoon, typically a Friday and a Saturday. So it's action-packed. We carry out not only the theory behind short-term orthodontic treatment, but the practical aspects as well, including hands-on exercises that allow all of the attendees to become familiar with the procedures that they'll use day in and day out with their 6-month smile procedures. And that includes team members as well, Howard. So we encourage team members to attend because, as I said, in terms of the ability to delegate duties and responsibilities, team members present at the course gain a vast amount of knowledge and experience, and they really get the process going within practices.
So how much does it cost to bring your assistant?
I'll have to double check that. It's a nominal fee for it. I'll double check that and get back to you with that, Howard.
Okay. And, well, since your name is Noel, Noel, which means Christmas, you could just say it's Christmas today and all staff are free. What do you think?
Well, I'm not sure I can go that far with it. And I wasn't born on Christmas, so I'm not sure I can extend that courtesy.
I love that name. I actually, it means Christmas. I think I used to think it meant peace too. But you said it's a French word for Christmas?
That's right, exactly. Noel.
I love name origination. It's so interesting. So then you said you have an advanced course too?
That's right. So we developed the level 2 course to allow providers who had reached a certain comfort level with 6-month smiles to be able to treat their cases more effectively, so finish to better results, treat them more efficiently, speed up the overall length of time, and then just broaden the scope of their comfort level, take on maybe a few more challenges. Typically, as with anything, we advise any new providers to crawl, walk, and then run. Just get started with simpler cases, gain that comfort and confidence level. As that confidence grows, they're able to take on more challenges. Now, I do want to stress, Howard, we're not looking to supplant comprehensive ortho. With all of my patients, I make clear the gold standard is comprehensive ortho treatment. But as I mentioned with my patient Jackie, comprehensive ortho just wasn't in the cards for her, something she wouldn't abide or tolerate at all. So now with 6-month smiles, we're able to provide our adult patients with an appealing, attractive alternative to comprehensive ortho.
Okay, explain the details of what 6-month smiles is. It usually first molar brackets all the way around, and
Yes.
then molar bands all the way around, and then brackets across the front 10.
Okay, so we use molar tubes and then brackets across the front 10 teeth. Now, the beauty of the
When you say molar tubes, is that a bracket?
It's bonded. That's right.
It's just
It's
bonded on the buckle.
Exactly. So we
You're
don't
not doing a
need
band?
bands. That's right. So now the beauty of the 6-month smile system is actually the fact that it takes the inefficiency of hand placing brackets and converts that to custom bonding trays. Once the impressions are taken, they're sent to the 6-month smile lab with a lab requisition. The lab pours up the models, and the bracket specialists actually precisely precision the brackets to the prescription. Then the lab specialist will create custom trays, and they're essentially suck down trays, an inner soft layer to hold the bracket in position with a custom bonding pad, a more rigid outer tray that maintains the positioning of the brackets themselves. And those are used to efficiently place the brackets in one step. One step seating means that we're able to place the brackets very quickly, very efficiently, and in the general dental practice, that makes all the difference in the world.
That is really, really slick. So what is the lab bill on that? And then what are you charging for what is lab bill on that? Then what are they charging the patient for
Okay, good.
6 month smiles? And
The
we don't want
typical
we don't want this in Canadian dollars. We want this in real
Absolutely.
money that you can spend at the store.
Well,
Just kidding.
especially with the value of the Canadian dollar right now, Howard, you're absolutely right. So the lab fees for 6 month smiles are about $700 to $800 US. The range of fees charged for 6 month smiles are anywhere from about $3,500 to $5,500 US. So, and again, it's a comfort level based on the provider themselves.
And
We
is that I'm sorry, is that one arch or two arch? Is that upper
Two
and lower or?
arches. That's right. That's for upper and lower arches. And the 6 month smiles lab will also fabricate the fixed retainers. They're inserted in exactly the same manner as the brackets, and that's using a custom bonding tray.
And that's a lingual bar on the mandibular lingual K9 to
Exactly.
K9.
That's right. It's a canine to canine
So that
fixed
seven
retainer.
to $800 lab fee is for upper and lower, 10 bracket instant seating for the upper and lower,
That's
and
right.
then a mandibular retainer.
Well, we actually use mandibular and maxillary retainers to hold the teeth in position. The philosophy that we use is actually fixed and removable retention, Howard. The fixed retainer ensures that the social six stay in position just beautifully. The removable retainer is a nice backup as well.
Okay, so I'm sorry. So that fee includes a mandibular lingual bar retainer with two wings
That's right.
on the
And
linguals of the canines, but the upper is a removable retainer.
no, the upper is a fixed retainer as well. So the seven to eight
Just
hundred dollars.
all just lingual pads on canines and then a bar connecting.
Well, we actually use pads on each of the incisors as well. That
So
ensures that the
six
teeth are,
pads.
that's right, the teeth are locked in just beautifully. We also provide other alternatives in terms of the fixed retainer. For instance, the chain material Orthoflex Tech works really nicely as well.
Explain that. What's that?
Well, it's a chain link material that's bonded directly chairside to the teeth. So it's cut from a roll. It's bonded directly to the lingual of the teeth using a flowable material and locks the teeth into position just beautifully.
I just heard back from Ryan Swain. The answer was yes. That'll be awesome. Um, so when you're doing 6 month smiles, do you also? I mean, patients. You say you're building a brand name before they come in and ask for 6 month smiles.
That's right.
Patients are coming in asking also for Invisalign. There's now an Invisalign lower cost alternative, Clear Correct. There's Inman aligners. What do you think about all those? I mean, do you
Each,
in your practice do you only do 6 month smiles, or do you sometimes use Invisalign? Do you sometimes use the new the one Clear Correct?
yes,
Do you ever use an
absolutely, Howard.
Inman aligner? Do you ever use other stuff?
Yes, I do. And it comes down to the fact that we don't have one catch-all solution for every single patient in every situation. I always tell my patients that there's rarely one absolute correct or incorrect answer. What we try to do is provide them with options. Now, typically, I find that the use of brackets and wires is not only more efficient, but also more effective in terms of being able to move teeth into alignment quickly and efficiently. So my preference is always to use brackets and wires to move the teeth and have greater control as opposed to aligners. But once again, in terms of aligners, they have their place as well. There are patients who will be very specific that they will not have brackets and wires on their teeth, and so aligners are a great option for them as well.
So you call Invisalign, ClearCorrect, Invisalign, you call all those aligners? Is that
That's right.
that's the generic
Exactly.
term for that?
That's right.
You just can't make generalizations. I mean, it comes off bad. I mean, you can't say all Irish people like me are drunks when only 38% are. That'll piss off the other 62%. But in my 28 years, the bottom line is when I bond on the brackets, I'm in control. When I hand you removable retainers, now you're carrying the ball. And what I've noticed is that girls will do anything to look better, and they're so compliant. But I have had so many cases where boys, they go into it motivated. Well, if their mom wants it and they're not motivated, and they're sitting there in the chair with their hair matted up and a burger hanging out of their nose, you just know they're not gonna be compliant.
Exactly.
I tell people this, they say, I just don't have that problem. And I just think to myself, well, I'm in Phoenix. I mean, it's not like I'm in Scottsdale or Beverly Hills. I mean, I'm in a normal cross section of America, and young boys, I mean, if they don't, they have the look. If they look well groomed and they just look GQ, they'll do everything I say. But if they look sloppy like me, they just don't comply. It just takes so long. You know what I mean? Sometimes they don't even finish.
Exactly. Well, and you hit on a really key point, Howard, and that's compliance. I actually have a fair number of patients who come in looking for 6-month smiles who are in the midst of a aligner treatment. And they simply say, it's been going on too long. I'm not seeing the results that I want to see. And so I want to switch over. I want something that's going to be effective, that will straighten my teeth, that will give me the smile that I want. And I don't want to be using these aligners for another 6 months, 12 months, year and a half. So providing that option is a wonderful alternative. As you said, typically females are great with compliance. Males need that little nudging. And so it's a key element in terms of assessing, well, how long is this treatment going to stretch out? Am I going to have someone who is going to comply? Am I going to work through the aligner series in a staged and controlled way? And that's key to making aligners productive and profitable and efficient within general practices as well, not having those surprises where we need to make mid-course corrections at all.
And talk about the lab bills. I mean, what's the difference in lab bills between 6-month smiles and like Invisalign?
We're probably about a half to a third
Yeah.
in most cases, so
Yeah.
it's a dramatic difference,
Yeah.
and one that resonates with most providers who start up. The key thing, though, is, there's that enticement, that lure in terms of, okay, lower lab fees, I have a little more control of it. The real eye-opener for new providers is seeing just how efficiently the teeth move, Howard. Again, once you place brackets and wires on the teeth, there is no compliance issue. They're moving 24/7. And so we see those dramatic changes in a very quick time. In fact, if you think about patients who are undergoing comprehensive ortho in your practice, they come in at about the 4 to 6 month point seeing the orthodontist. You see most of the crowding unraveled already. A lot of the alignment is already in place. And that's where we're focused, cosmetically aligning the teeth, giving the patient a smile of which they can be proud in a very efficient timeline.
Now, is this all round wire, or do you finish in a rectangular wire?
Yeah, so we do have rectangular wires in the 6-month Smile Lucid Lock system, but the typical series that we use is all round wires, light forces. That incidentally allows not only efficient movement of the teeth, but great comfort for the patient as well. And it's rare actually that within the context of the goals of 6-month Smile short-term ortho that we need to finish or use rectangular wires at all.
Okay, can you explain? My job is to guesstimate questions on these users. Some kid's driving to work and he don't know the difference between a round wire and a rectangular wire. Can you talk about the difference between a round wire and a rectangular wire?
Absolutely. So a round wire is, as it sounds, round. If you think about the cross section of a bracket, Howard, it's essentially a rectangular space. And so a rectangular wire fitting into that rectangular slot will allow more control over the movement of the teeth. And that relates primarily to torquing of the teeth. When we talk about torquing, we're looking at moving the roots of the teeth labiolingually, and rectangular wires work very efficiently in that context. Round wires, because they don't engage the squared slot walls, will not have that torquing ability. And that's one of the key differentiators between short-term orthodontics and comprehensive ortho, the fact that we're not looking to torque teeth labiolingually.
And I know some people are afraid of ortho because what you need mostly on ortho is the diagnosis. I mean, like I say, the assistants can help you do all the technical stuff, but you got to get in there with the right diagnosis and treatment plan. Talk about what are ideal, because these people are driving to work. They've got a bunch of patients already. They've seen a bunch of patients. What's an ideal candidate for short 6-month smiles? And what is the red flag where you don't want to, stay out of trouble? Don't do that.
Okay, great question. So the ideal 6-month smile patient has mild to moderate crowding or spacing. So mild to moderate, anywhere from about 4 to 6 millimeters of crowding or spacing in each arch. They treat beautifully with 6-month smiles, especially the crowding cases. They unravel just beautifully. The results show very quickly. Patients come in to their adjustment appointments excited. They want to be in because they see these results occurring. Similarly with space cases, that 4 to 6 to 8 millimeters of spacing closes up just beautifully using 6-month smile protocols. There are some red flags for short-term orthodontic treatment. Those can include overjet. If a patient is looking to address the overjet, whether it's a large positive overjet with a class 2 situation or a negative overjet with a class 3 underbite situation, those are potential red flags. If the patient is looking for changes in the midline, we can affect changes of about 2-3 millimeters with 6-month smile treatment fairly routinely. But beyond that, or looking for precise midline coincidence, that is a typical red flag as well. That's better suited to comprehensive orthodontic treatment. And then anything relating specifically to the bite, Howard, is in the realm of comprehensive ortho. So if a patient presents asking for an ideal bite, then we typically will send them to the orthodontist for the consultation there. It doesn't mean that the patient won't return. Very often, once the patient understands what's involved, if they are looking for cosmetic improvement in their smiles, almost invariably they're back asking, okay, can we get started on 6-month smile treatment?
I don't think they should even treat class 3s, because then your child might grow up to be a comedian, have their own television show, be the next Jay Leno. I mean, I think that's his whole stick, is that big old mandible. Hey, I gotta tell you my thoughts on midline. You're more qualified to talk about it than me, but you know what? At least when I was learning ortho back in the day and everything, at least 100 times when you're sitting there at a conference at lunch or dinner or whatever, and I'm talking to some dentist, he's there with their spouse, and I'll tell you, then I say, look at me in the eyes right now. Just only look at my eyes. Is your spouse's midline straight on, or is it to the left a millimeter, right? And tell me describe your spouse's midline. Oh my God, they never knew. So I'm sitting here thinking, why are we torturing all these people to correct the midline when the orthodontists don't know if their wife's midline is on? I mean, it just doesn't. And when you're talking to people, your jaws are moving, your teeth are moving. I don't think there's a dentist in America who has 5 kids like you or 4 kids like me who could even tell me where their own children's midline is. So why do we care about midline if the dentists don't even know the midline is, and they're kissing this person?
Howard, you're making such a great point. So the 6-month smile philosophy is that children should be treated idealistically, adults should be treated realistically. So as with my patient Jackie, she wasn't willing to go through 2 years of treatment for that marginal improvement. Having said that, again, I'll tell you a couple things. One is in the introductory course, there's a segment in which we show photos of Penelope Cruz and Michael Jordan, and their midlines are heavily deviated, still have great smiles, still extremely attractive people. The other story that I'll tell you is a very personal one. Me. You asked me about the braces that I'm wearing. Back when my parents first came to Canada, typical immigrant story, we had 5 children in my family. We went to see a dentist. I had crowding, and so the dentist thought was, let's take a tooth out to try and relieve that crowding. Took out my upper right lateral incisor, and it eased everything up, but certainly not straight teeth. When I was going through dental school, one of the grad ortho students, a friend of the family, actually put brackets and wires on about a year and a half with painful rectangular wires, just aligned everything, got everything to the point where at least they were straight. Now, after I graduated, the orthodontist, a great one in my area, who was treating my children, I thought, you know what, let's get things sorted out once and for all. I went to him and I said, okay, do me. I sat down in the chair and I said, I want the midline shifted back. I want space opened up for an implant at that lateral incisor. He leaned me back, took a good hard look for about 10 minutes, sat me back up, Howard, washed his hands, rubbed his hands together, and he said, I'm not touching you with a 10-foot pole. And I asked him, why not? And he said, because I'll never be able to achieve the results that I want to achieve for you. It's really going to be unrealistic. And I'm not even going to delve into whether we can get a good aesthetic result with an implant at that upper left lateral. So you're absolutely right. The fact that we have ideals are absolutely great. And that's why I'm proud to be a dentist, because uniformly we're all striving to provide our patients with the best possible results that we can, incorporating the scientific, the health aspects of it. But one of the elements that we do have to realize, one of my sons is graduating from dental school this spring. And one of the key things that I instill in him, as well as all of my associates, is always remember there's a person attached to the teeth that we're treating. We have to be aware of that, provide them with options that will allow them to satisfy their treatment objectives in a realistic manner. Certainly one that holds true to our ideals in terms of providing them with sound dental care, but one that serves them well as people.
I think you the other thing you have to realize about ortho, it is the law of diminishing returns. I mean, when you start someone an ortho, the next month they come in, the patient's like, oh my God, and there's so much movement and there's so much movement. But as you get into like month 12 and month 18 and month 24, I mean, as a dentist, you can't even tell what's moved in the very end. So
Exactly.
ortho starts off with just a bang and then slowly goes down to nothing. And what you're saying is that in 6 months smile, let's get the 80-20. I mean, we're not going to torque all the roots. We're not going to line it up like it's an anatomy textbook. We're just going to make your teeth whiter, brighter, and sexier and level and align and just unravel everything. And that's, you can get 80% of it done in 6 months. Is that kind of...
That's it in a nutshell, Howard. Actually, it's kind of interesting because when we are providing support on the 6-month Smile Forum, we'll have those dentists. And again, we as dentists tend to be the anal retentive types, aren't we? We want everything just so exactly according to the textbooks. So very often we'll have providers saying the patient is over the moon with the results, ready to get the braces off, but I want to tweak this one tooth just a tiny little bit more. And the reality is, in many of those situations, it doesn't even show aesthetically. It has no functional impact at all. It's just our mindset to say, I want everything as perfect as possible. So again, you're absolutely right. As we reach that point where we've achieved all of the treatment objectives, we're actually doing the patient and ourselves a disservice thinking that we have any benefit carrying on to comprehensive orthodontic ideals.
And they also do that with restorative dentistry. They're working on some hillbilly that hasn't brushed their teeth or hasn't even flossed one time in the last 10 years, and they come in with plaque and tartar all over the teeth, and they're fixing the filling, and they're already 5 minutes late, and they realize that something's just not quite right with it. So they drill it out and redo it, and they're running 30 minutes late trying to go from a B plus to an A minus, and they stress out all the staff, they stress out everyone, and I know it's very controversial to say this, but I do A dentistry on A patients, and I try to do A dentistry on B, C, D, F, but I'm not going to run 30 minutes late on a D or F patient who's, you know what I mean? I mean, if this filling's, a B, it's good enough, and I'm not going to stress out my assistant and stress out everybody trying to get these anally retentive results on customers who don't even care. I mean, a lot of these dentists are working on a patient that only came to them because they take the discounted PPO fee, so they're not even willing to pay fee-for-service premium, and then they don't even have enough gumption to floss. They don't have enough gumption to get their teeth cleaned every 6 months, and you're redoing your work 3 times because it's not perfect. So
Exactly.
perfect can get you in a lot of stress.
Yeah, and that's the practical side of it. The fact that, again, we do have that desire as dentists at the core to deliver as ideal a result as possible. But the reality is we have to recognize, whether we own our own practices or associates, that dentistry is a business. It has to be run efficiently, productively, and part of that is being sensitive to not only the timeline efficiencies with scheduling, but also the patients that are receiving the work as well.
So
And
you said you immigrated to outside of you're in Streetsville is a suburb of Toronto, right?
that's right,
And how old were
exactly.
you when you immigrated? Were
3 years old. So
and where were you from?
Burma, which is now Myanmar, Howard.
Burma, which is not, wow. Hey,
So the other side of the world.
hey. So you were 3, so you probably don't know anybody back there, do you? Or do you still have
No,
family back there?
we still have family there. I haven't had a chance to go back and visit, but they come regularly to visit here. So
Well, my goal, my fantasy goal is to do a podcast interview with someone from every country on earth, and I just think that would really make an international community. I mean, the smartphone's international, iTunes and YouTube is international, and so if you know anybody back there, if you know they have a dental school instructor, whatever, if you think someone would be fun, uh,
absolutely, I'll
so,
reach out and then keep you
hey, and
connected
I
with
was
you.
also wondering, on the 6 month smiles, how many people are on that community?
We have well over 7,000. I think we may be up to about 8,000 worldwide right now.
Oh my
So
God, that is
across,
amazing.
it is, and again, I can't stress enough just how supportive that community is. Once providers are on the 6 Month Smile Forum, they're absolutely shocked at how supportive, how positive it is. And again, we all learn from each other, Howard. That's part of great dentistry as well. One aspect with dentistry in general, whether you're in a solo practice or a group practice, is it is a very isolating type profession. We're centered on a small area of space, focused on that area. Opening up with the 6 Month Smile community allows us to gain input as well as interaction, not only for our 6 Month Smile cases, but understanding dentistry is a great career, a great profession. We're very privileged and fortunate to not only be able to provide our patients with a great service, but earn a good living and have fun doing so as well.
I want to always stay on the controversial stuff and avoid everything that goes on. You remember when back in the day, because we're the exact same age, we're both 53. Remember back in the day in the 80s where orthodontists said that you mentioned Michael Jordan earlier, that they were saying something like 90% of African Americans were bimaxillary protrusive, and there were all
Yes,
these old school orthodontists that every time they got an African American, they would pull his 4 bicuspids to pull it back,
exactly.
and I'm sitting there, well, damn it, if they're already damn good looking and 95% are bimaxillary protrusive, then that's normal. How could that be abnormal? Why would you try to correct a face to European measurements or something like that? Do people,
Exactly.
is that all dead and extinct now in 2016? Or are there still old
Well,
school people that think things like that?
yeah, unfortunately, there is still that old school. So I still have my core of orthodontists to whom I refer, and some of them are of the mind that, for instance, if there is crowding, I'm going to extract straight up and then deal with aligning the teeth after. Similarly, achieving those ideals of the angle classifications, the canines, the first molars, overbite and overjet, sometimes they can be blinded to how those teeth actually interact with the individual. One of my classmates in dental school, Howard, just a beautiful woman, always perfectly dressed. One day we were waiting in one of the clinics, and she turned to me and she said, "I hate the way that I look." And I was taken aback. I said, "You're beautiful. Why would you say that?" She turned sideways and she said, "Look at my profile. They took 4 bicuspids out. Now I'm concave, and I just can't stand the way that I look." So that was with a view to reaching that textbook ideal at the expense of the practicality of how these teeth actually interacted with the patient's lips, the cheeks, the bone support.
When women tell me I'm unattractive, I just turn out the lights and it's instantly solved. Hey, you just used 2 terms that someone might not have understand. You just said overbite, overjet, so now you got to explain that.
Okay, sure. So the overbite is the horizontal overlap between the teeth. So it's the way that the upper incisors overlap the lower incisors, how much of the lower incisors are covered by the upper incisors. The overjet is the vertical, or sorry, that's the vertical separation. The overjet is the horizontal separation. So how far forward or behind the upper incisors are from the lower incisors. And that's an important thing as well, Howard. As I mentioned, overjet can be a prohibitive aspect of a patient's chief complaint. So if they're a class 2 patient with a skeletal class 2 jaw type and they have a lot of overjet and they're looking to correct that, short-term ortho and even conventional orthodontic treatment isn't going to correct that. Very often that's a surgical intervention. And so we help our patients to understand the scope of the treatment objectives that we're looking to correct.
And it's amazing, when I got out of school in '87, whoever was doing implants was just called the butchers, and a lot of them end up having their license taken away. I mean, some of the most famous implantologists, their first big case that failed, they got their license taken away. I thought that was sad. And orthodontic surgery was pretty crazy in the '80s, and it's
That's
amazing
right, exactly.
how much more of a minor surgery that's become, how much more sophisticated it's become. I mean, it's gone from, I remember walking into the hospital in '87 to visit a patient, and their head was so swollen, even me as a dentist, I gasped. I mean, I was like, and all in the '80s, I would say 80s till '95, 100% of everybody I met that got orthodontic surgery said they had to do it over again. They wouldn't do it.
That's
And
right.
now it's a lot more minimally invasive. I want to say one other thing that I think is the biggest advantage of 6-month smiles, and that is back to this crowding thing. A lot of times the orthodontists, I don't understand why we don't work better together, but the orthodontists say, oh, there's this much crowding, we need to extract 4 teeth or whatever, or it's going to take this long to unravel. And I'm a general dentist, and I'm looking at this mouth, and obviously cosmetics, I want whiter, brighter, sexier teeth. I'm looking at a bunch of MOD amalgams, and I'm looking at an ugly PFM, and I just sit there and I'll just take that arch and I'll just take all the dentistry out of that arch and then replace the MOD amalgams with MOD composites with open contacts, and you can pretty much get all your space just by, you can take off a over bulbous PFM and put on an all ceramic tighter crown or whatever. But
Absolutely.
if they got a arch full of dentistry, I can almost always create all that space.
That's right. Well, actually, you hit on a key point. One of the other elements of 6-month smiles, whether it's in the planning stage or during the process of treatment, a co-discovery process for the patient themselves, Howard, is the adjunctive treatment that can occur. So I mentioned that large overjet isn't going to be corrected with 6-month smiles, but deep bites are. So we've all seen those class 2 cases with the deep bite, 100% overbite, the lower incisors actually either worn down or traumatically occluding on the palate. 6-month smile short-term ortho opens up those deep bites just beautifully. But it's also a great starting point in terms of any cosmetic procedures. I spoke at the AACD meeting in May in San Francisco last year, and I'll be there in Toronto this year as well. I do a lot of 6-month smile treatment as a springboard to cosmetic or reconstructive cases. Just, again, as you mentioned, getting those teeth into better position so that I can deliver better restorative results for the patient. So it really is an eye-opening process in terms of seeing the scope of what we can provide for our patients, whether it is simply straightening the teeth, closing spaces, giving them nicer smiles, or allowing us to do better dentistry overall.
Well, I think the purpose of the American Academy of Cosmetic Dentistry and the purpose of cosmetic dentistry is the simple phenomena that when you're dealing with a human, I mean, every day they need information, but they mostly need motivation, and they either haven't been bowling in 10 years or they own their own bowling ball. They either haven't gone to the lake in 10 years or they own their own boat. And when humans don't like the way their teeth look, they don't take care of them. They're not into their teeth. They don't brush,
Exactly,
they don't
Howard.
floss, they don't get cleanings. And I first noticed that in bleaching back in 1987 when everybody was saying, oh, there's no research and no one said anything and this is crazy. You would bleach this person's tooth and they would wake up to dentistry. They would wake up to getting into their mouth. And as soon as they were looking, then they were brushing, flossing, then they wanted this black thing removed and they wanted this fixed. And the most important thing of bleaching and bonding and 6-month smiles and all that is you need this little monkey to like their teeth. And if the
Exactly,
monkey
that's
likes
right.
their teeth, they'll have oral health. And if a monkey doesn't like their teeth, then they're not going to take care of them. They don't care. They just forget it. And then that leads to disease and all kinds of things.
Well, just yesterday, Howard, we finished up all of the restorative on a patient who had undergone 6 months smile treatment. So he had amalgams throughout his mouth. Teeth were crowded. We undertook 6 months smiles, aligned them just beautifully. All of a sudden, he loved his smile and he wanted to do more to enhance it. And so that led to progressively carrying him through replacing all of the amalgams, placing some crowns, some onlays in there, which has completely transformed his mouth, his smile, but more importantly, how he feels about himself. And I couldn't agree with you more, Howard. I always say a great smile is like a great outfit. You don't need a designer label on it. You don't need a price tag. Everyone notices it sits well, the material may be nice, but the most important element of it is how it makes you feel. You walk into a room with a great outfit or a great smile, you own that room. You know that you feel like $1 million and that confidence just soars. It doesn't matter whether it's a social or a work setting. It just has that profound influence on you.
Oh my God! I see it in bikes too. I do a lot of biking, and somebody, they never biked ever, and they think they're going to do the 70-mile Mesa bicycle deal and everything, and they go in there, and if they see some pretty bike that's cool and jazzy, and they just love their bike, then they want to go jump on their bike and ride it. And a lot of people ask me, what type of bike do you recommend, or this or that, because all, and I just say, get one that you just want to get on. You know what I mean? That makes biking fun. It's all about stuff. I want to talk about something else that's controversial, and that is slenderizing. Sometimes when you got crowded, some people like to go in between the incisors
Yes.
and slenderize. There's some automatic slow speed attachments that do it. Some do it with fine diamonds. Some don't believe in it. What's your thoughts on slenderizing?
Slenderizing, most of the orthodontists to whom I refer slenderize for their comprehensive cases without any concern at all. And it is part of the 6-month smile system. But one of the interesting things, Howard, is that especially for those new providers who have used aligners and with the prescriptive amounts of slenderizing or reprox to be carried out, one of the biggest things that we need to do is stress to them, be very, very conservative with slenderizing. So within the 6-month smile system, we provide 3 elements to carry out slenderizing. Diamond discs, diamond strips, and diamond burrs. And they come with each of the patient tray kits, the setup for each patient. Those are used.
Strips, burrs, and what?
And discs.
And discs.
And that's right. Each of those is used in very strategic positions, locations, and we show and teach that in the introductory course. But we stress the fact that slenderizing should be a conservative and a progressive process, one which doesn't place the tooth at a greater risk of caries susceptibility, doesn't compromise the aesthetics of either the tooth form itself or the contact form. And so it is a very integral part of helping us to create space in order to align the teeth. Now, one of the great benefits of fixed brackets and wires is that the arches round out, and that's simply the teeth moving out into the shape, the form of the arch wire itself. And that in and of itself creates a fair bit of space, Howard, and that's one of the reasons that we stress, don't be aggressive with slenderizing teeth.
Well, tell me if this is right or wrong. I think slenderizing adds to long-term retained stability, because if I held a softball at each hand and tried to hold a softball in the middle, it'd be a balancing trick. But if I held a brick in each hand and tried to hold a brick in the middle, it'd be very, very easy.
Yep,
Do you think when you slenderize, you can go from a very rounded mesial distal tooth to just putting a little bit of flatness on it, just a little bit, that just kind of locks in and it's a lot more stable and less crowding?
Well, rounded contours aren't prohibitive to positional stability in and of itself. So there are other factors that impact on the potential for relapse to occur. Everything from the gingival fibers themselves to outside forces such as the soft tissues, occlusion forces as well. And that's why we stress dual retention, both fixed and removable retention, to hold the teeth in place. One of the greatest sources of 6-month smile patients are individuals who have gone through comprehensive ortho as teenagers, come in saying, look, I had 2.5 years of orthodontic treatment. Look where my teeth are now. I want that nice smile back. So it's a little more involved than that. However, having said that, 2 approximated flat surfaces will tend to stay a little more stable than 2 rounded surfaces coming together.
But you think that's pretty low on the totem pole as far as what's causing the relapse?
That's right. It's not a primary factor in the relapse, but again,
Talk about go through the most primary to the least primary factors. Are you doing any soft tissue releasing sometimes for
no,
stability?
no Perrycision whatsoever.
Is that theory gone now, or what are
For
you?
the most part, I don't think I've come across an orthodontist in the last 15 years who's used Perrycision at all. So, there are a lot of factors
Man,
that influence.
you're old when you've lived so long that now some of the stuff you learned in school hasn't even been. No one's done it for 15 years. It's probably
Well,
I should probably go to a vet and be put down. They're probably I probably got too. So that's extinct. No more.
that's
What did
extinct.
they call that?
Perrycision. So
Perrycision.
it's simply cutting the uh, circumferential fibers, holding the tooth into place, allowing them to release potentially, and then allow the fibers to reattach, reform without that shape memory. Although there are no conclusive studies that show that it is effective, and so that's why it's fallen by the wayside, Howard. But in terms of the relapse itself, or the potential for relapse, different factors at work. Everything from the periodontal or the attachment fibers themselves to occlusal forces. Mandibular growth can continue well into adulthood, and so we can see vertical growth of the mandible changing the relationship between particularly the anterior teeth. Occlusal factors can come into play, habits, soft tissue forces, the lips, the cheeks, and the tongue. So it is very multifactorial in terms of potential for relapse, but it is always there, regardless of whether it is comprehensive or short-term ortho, and that's the necessity of retention. Once we get a patient having a great smile that they love, we want to keep them loving that
I
smile.
want to ask you another very controversial. I'm down only 4 minutes, but you know, there's a lot of freaks who just they quote the research like the Bible.
Yeah,
And then and that's all good, but that can be bad too, because 100 years from now, a lot of the things we believe now are going to look silly. And
exactly.
and the orthodontic research is telling us that when the mandibular wisdom teeth erupt, that's not causing the lower anterior. They say
That's right.
research wise that's not true. But god dang, it sure seems like that. I mean, I see patients every day for 28 years, and it just seems like those teeth are coming in, and those lower incisors are just folding. So, do you believe that has no relation to the wisdom teeth or not?
My personal belief, based on the studies I've read, is that there is no relationship at all. It tends to be a coincidental timing with the eruption of the wisdom teeth, the changes that are occurring in mandibular positioning and growth, and so it tends to be an overlap of timelines. But having said that, I still know a lot of dentists and oral surgeons and orthodontists who still subscribe to the wisdom teeth are going to cause crowding, so let's get them out as soon as we see any sight of them at all.
Yeah, and I noticed that in more advanced civilizations. I always think of the United States as kind of a redneck hillbilly country. I still think Canada, Scandinavia, Germany. I've been to so many countries, and it just seems like they're just more of an advanced, civilized country. And I noticed the Germans are pulling a third less wisdom teeth than they did 10 years ago, and about two-thirds less wisdom teeth than they did 25 years ago. And have you noticed that?
Same thing here, Howard. There's
Yeah,
still that prevalence of old school dentists who will say, if I see wisdom teeth, they're coming out altogether.
right.
But more and more, we're leaving them intact. And I think most of the research shows that the potential for the untoward effects of the surgery itself outweigh any potential risks of leaving the wisdom teeth in place. So typically, I always advise, unless there is the potential for a problem, any either periodontal pockets, the potential for cystic formation, then the wisdom teeth can stay in place.
Hey, my job is to, do these podcasts for free because I know they're going to listen to them on their smartphone, and I've noticed that, my 20 years at the 20% of the dentists in my neighborhood that went to the monthly study club once a month, they just learned something to keep them fired up and motivated, and over the decades, did happier practices. They were more successful than ever. And I know at the end of the day, I know it's tough to drive across town and go to the study club and eat the rubber chicken and all this stuff. So I'm trying to bring this study club into their car on the way to work. But a great marketing thing for you to do, you should create a 6-month Smiles course on Dental Town. We put up 350 courses, They've been viewed 500,000 times.
Wow.
And you got 8,000 people on your site. Dentaltown has 205,000. I'm sure you'd find a couple thousand more people on Dentaltown and to go over there and talk ortho. That might be a great marketing thing.
No, I'll bring that up. One of the aspects with 6 Month Smiles in terms of the support, Howard, is that we run regular webinars as well for the 6 Month Smile provider community. Now that, as with the forum, is very focused to the existing community where we bring out advanced topics, tips, techniques, tricks, case reviews. But I will bring that up because extending the reach
you could put a couple of those webinars already done into a series on Dentaltown. You've probably already got the webinars to do a 1 hour or a 2-part or a 3-part, I'm sure 10 people have to see it before someone, that one person's just turned on and it's the right place, the right time.
Clicks.
Hey, another thing I was wondering, can you email me that picture of Michael Jordan and Penelope Cruz?
Absolutely.
I'm dying to see it. And that is just I want to say, because I you know what a bald man thinks of Michael Jordan. Seriously, because we're the same age. You know what this bald guy thinks of him?
What's he think of him?
Well, it's a fact. I mean, I lived through it. I'm a bald guy, and before it ever, when you were in college or high school or whatever and losing your hair, people would always say, "Oh man, that's bad. Are you going to get a toupee? Are you going to wear a wig?" And it was like this big negative thing, and I'm like, whatever. And then the Phoenix Suns played the Chicago Bulls in that basketball series to the final deal. And for 7 games, the whole country is watching these two teams with the two most handsome bald men that ever lived, Charles Barkley for the Phoenix Suns and Michael Jordan for the Chicago Bulls. And I swear to God, I'll swear on my father's grave, the next day, bald was cool. The next day, the comb-over stopped. The next day, people with hair like you started shaving their head. I mean, Michael Jordan and Charles Barkley single-handedly took bald to a disability, to the in thing, and there they were with their Nikes and flying around, and they did. They made bald cool. So I think Michael Jordan has got to be probably the most handsome man that ever lived. So I'm dying to see his midline. I never ever noticed.
I definitely will send you those photos, Howard.
And who's Penelope Cruz? That's a movie star, I take it?
That's a movie star. Actually, I think she was dating Tom Cruise for a little while. But
so she's not right in the head.
And let's see. I think her newest movie is Zoolander 2.
I love that show, Zoolander.
So she's in the new one as well, and so you'll have a chance to see her there. But
And
I will send you those
she's
photos.
a pretty girl, but her midline's off.
Exactly.
Yeah. Okay. I'll still never forget the most amazing cosmetic study I ever saw back in dental school. It was done in Kansas. It was done in Scandinavia, and it was totally randomized in college universities. And they took this broad sample of boys and girls in college age, and they had them sit down for pictures. And they said, "Okay, think of something sad." And then they took a picture and they said, "Okay, think of the happiest thing in life." And then they mixed those photos around. And just being happy bumped you up about 2.5. On a 1 to 10, the bump was like 2.5.
Okay.
So it's like if people are just radiating happiness, they look good. I mean, the best cosmetic dentistry you could ever get is a smile on your face.
Exactly. And Howard, I can't tell you the number of times I've had those big strapping 6'4" guys who never want to show their smiles. They walk in during the course of treatment. This is before they're even finished. And they tell me, my coworkers, my wife, my girlfriend, my family say they've never seen me smile so much. I don't really notice it, but I guess I just like my smile now. And that's absolutely right. If you feel good about your smile, you're going to smile. If you're smiling, you're going to look great to the world.
And we're in 3 minutes overtime. I got to wrap this up. But here's the thing that it took me forever to develop. But if you can develop this straight out of school, you can do 1,000 more cosmetic cases. And that is, when you're talking to a patient, the ones that hate their smile, especially girls, have really fast hand movements to cover their smile.
That's right.
Whenever they laugh, they just, and you don't even see it. It's so fast. They just got these lightning fast, cover the mouth with the hand. And if you spot that one time, she hates her smile, and you can just go there. You know what I mean? And
That's right.
that's the hottest lead you can get is a woman who covers her mouth when she smiles.
Well, that's exactly it. I always ask my patients at the consultation appointment, think about photos, videos that are shot. How do you feel about your smile? When someone says, okay, everyone's set up for a photo, are you shy? Do you turn one way or the other because you think you have a good side or a bad side? And very often that relates to the smile itself. What we can do for our patients, not just giving them aesthetically pleasing looking teeth, but actually impacting on their lives is profound. And that's why I would encourage anyone listening, take a look at 6monthsmiles.com. As I said, it's a rewarding process being able to align teeth in a very efficient way, but really the joy of seeing the impact that we have on our patients and then the effect that it has on our practices, both in terms of productivity, absolutely, but also how the entire team feels about what we're doing for our patients is truly profound.
And what if one of my homies wants to contact you? Can they email or can they contact you?
Absolutely. So you're welcome to give out my email address. It's Noel at 6monthsmiles.com.
Now, did you also get just like with 6monthsmiles.com, you can do the numeral S or spell out six.
That's right.
So for Noel, can they also just type it Christmas at 6monthsmiles.com?
Now
And it'll
that
come
may
to you
take it
too?
a little bit further, but those emails
How
may
about
wind up.
Xmas?
Well,
How
they may
about
wind up
Xmas?
at the North Pole, and Santa will be answering those, Howard. So it'll be out of my hands there. But again, if
Hey,
anyone has questions, by all means, feel free to contact me.
hey, no, seriously, dude. Thank you so much for spending an hour with me today. I thought this was extremely fun and informative, and thank you so much for doing this.
Howard, it's been my absolute pleasure. I will send you those photos as well.
Yeah, I do. Send it to howard@dentaltown.com. I can't wait to see what the most handsome man on the earth, Michael Jordan's midline is.
Okay.
All right,
Thank you
buddy.
very much.